In this morning's Health Watch, migraine misery. These powerful headaches affect more than 30 million Americans. They are actually 3 times more common in women than in men, and they can start at any age. For some patients, that means a daily struggle.
I've suffered from migraines for the past 19 years, and I'm 22. My headaches started around the age of 3. They noticed I was getting really car sick, and I was throwing up a lot. And so they sent me out to a neurologist, and they confirmed that I was getting migraines. I think my first recollection is being in the emergency room, maybe when I was 5 or 6, and I just remember being in excruciating pain, and I called it dry screaming because I would scream without any voice. And by 7th grade, over the summer, I went to the ER 3 times in 24 hours, and right after that, they became daily. Usually it's throbbing in both my temporal lobes. Sometimes you can even feel my temples spasming. My triggers are different types of smoke, tobacco, cigars, if I don't get enough sleep or if I don't eat regular meals. If I go to a place with strobe lights is guaranteed. It could be loud music. I mean, it could even be just looking at the sun the wrong way. This is my arsenal of medications. I don't know any other different way of life. I've known pain, and I can't imagine a life, actually, that was completely different.
That is awful to hear from someone her age, that she can't imagine a life different without this pain.
Yep, it really is.
We hear how intense it is, but for people at home who may be wondering if their really bad headache is a migraine, what's the difference between a headache and a migraine?
Well, listen, this can be difficult even for doctors to really accurately diagnose, because the fact of the matter is a migraine can mimic signs of a stroke, signs of a ruptured aneurysm even. The key really between a migraine and a regular headache, however, is really severity and the associated symptoms. So you can see things like nausea, vomiting, light sensitivity, sound sensitivity, even potentially some neurologic signs like numbness or tingling on one side of the face, or even in cases difficulty speaking. It can be hard to tell the difference. The key is for you, if you know you suffer from migraines, don't assume then that you can't have a stroke or a ruptured aneurysm, and if it feels different, seek medical attention.
Samantha mentioned she started getting migraines at age 3, which just seems unimaginable. Is this genetic?
Well, there's always a genetic component to most things in medicine, and migraines are no different. They're actually looking for the migraine gene. About 20% of migraines can start in children as young as 5 years of age, and it can be more difficult to diagnose in children just because they're less able to accurately communicate sometimes what they're feeling.
Absolutely. Gosh, I can't imagine my kids dealing with that. What are some of the common, Samantha mentioned her common triggers.
Right.
Do those hold for most people?
No, they're really different for everyone. You know, some of the more common ones, we hear a lot about things like chocolate, aged meats or cheese, some red wines, changes in the weather, or even hormonal factors. And really, it is different for everyone. So if you suffer from migraines, you want to know what your particular triggers are.
So the causes can be different for everybody. What about the treatment?
Well, we really divide it up into a couple of different categories: rescue medications, prevention, and lifestyle management. Things like Botox are even being given now to prevent migraines. So again, speak to someone who's an expert in headaches.
All right. Jen, thanks.
You bet.